Hi, this is Yaffi Lvova, registered dietitian nutritionist and owner of Baby Blue Nutrition, and welcome to Naptime Nutrition. Today we'll be talking about weaning, how to wean, the process of weaning, and my co-host today is Rena Reiser, who is an intuitive eating coach and a lactation counselor. And also trolling the comments is likely going to be Amy Woodward-Clark, who is IBCLC, local to the General Phoenix area. So if you have any questions or comments, we will I'll be happy to address them. And so today we're going to be talking about weaning. And I know before I've covered baby-led weaning, I just want to cover the difference again. In British English, weaning is the introduction of solid foods. And in American English, and as well as certain other places in the world, weaning is cessation of breastfeeding. So we're going to be talking about ending the breastfeeding relationship today. How do you know when to do it, how to do it? And so I'm very happy to have Rena on with me. Thanks for joining me.
My pleasure. Glad to be here.
So I'm going to start with the World Health Organization recommendations. So we're going to start off with the textbook and go from there. So the World Health Organization recommends breastfeeding exclusively for at least 6 months, really breastfeeding a year and longer as far as you're comfortable. But they say exclusively up until 6 months because that's in general when you're starting to introduce solids. There's a big difference between nutrition and comfort as far as the nursing relationship. So not only is it a source of nutrition to the baby and the main source of nutrition until that 12-month mark, but it's a source of comfort not only for the baby, but for the mother as well. So Rena, do you have something to say about the hormones and the relationship associated with that?
Absolutely. So when the mother is nursing, so the hormones are pretty consistent, and as weaning starts to happen, the hormones start to drop. So there's a lot of feel-good hormones that come every time there's a letdown. So there's that rush of oxytocin that runs through her body, which generally for most women invokes like a really good feeling, a very loving feeling for herself, for her baby, for the whole wide world around her. So all that's really amazing to be able to have.
Yeah. So there really is more to it than just for nutrition. So I do want to also touch on a possible switch to formula. There are certain circumstances where a woman is unable to nurse due to medical concerns or physiological barriers, or going back to work. Pumping sometimes is not so effective. And I just wanted to really open the conversation to that as well. It's not really the focus of this topic. I just wanted to give a nod to the moms who have had that struggle and just give you a little bit of recognition there.
Absolutely. And a lot of women find that not even that the pumping isn't necessarily effective. Sometimes it is effective, but the stress that they're under going back to work, getting their baby out in the morning, not sleeping enough. So that in and of itself, in some women can lower their milk supply. And that sort of brings an early end to their nursing relationship, earlier than they might have envisioned otherwise.
Right. It's a major source of stress, and stress causes, it's a cycle. So however we can help a woman to avoid that cycle, that's what we're here for. But
yeah.
Just wanted to definitely mention that, that the whole, I did a Naptime Nutrition on fed is best versus breast is best, and that was a very controversial topic. But if you're interested in that, go check it out, and definitely for feeding your baby, obviously. So there are certain, aside from the physiological reasons or work reasons why you might stop the breastfeeding relationship earlier than anticipated, there are also societal or cultural barriers, relationships with in-laws, for example, or you feel like you're in a place that doesn't accept breastfeeding, or you don't feel comfortable breastfeeding in public. And these are all reasons that might lead a woman to decide to stop the breastfeeding relationship earlier than she really wants to. And it's so important when deciding to stop that relationship for a woman to know that it has to do with her and her baby, and to really feel confident knowing that that's her decision, not anyone else's decision, not society's decision, and she should listen to her body and her relationship with the baby as opposed to other family members or other societal influences.
That's right. Let's empower those mamas.
Yeah, let's empower those mamas. That's us, right? That's our club.
Yep.
So So a big thing that often comes up is that there are no tick marks on breasts. And I did an interview a while ago with a lactation consultant over here from Arizona Breastfeeding Center. And we talked about how there are no breast marks, no tick marks on breasts. So you don't know exactly how many ounces you're giving your baby. And it's not a concern as far as if your growth and development is on target. And so you really want to discuss that with your pediatrician, with your lactation consultant, and with your dietitian if you're working with a dietitian, to decide whether your baby is meeting their nutritional goals. And in most circumstances, the breast milk that you're providing will meet their goals, and you don't need to worry about someone who feels that they need to see exactly hard data on how much they're getting, because you're going to see that through the right amount of diapers, both poopy and wet diapers, and their growth, and if they're starting to crawl at an appropriate time or saying words at an appropriate time. I'm sure you have more specifics on that. What did you learn that a woman should look for when determining if her breast milk is meeting the baby's needs?
So it's for the first week or so after baby's born, even less time than that, depending on how much the baby's eating and how well the feeding relationship is going. So for the first few days, the baby will be, their first bowel movements are meconia, which are a very, very dark, more thick sort of substance that comes out. And once that leaves their system, so then they start having the more mustard colored bowel movements, the yellow seedy ones, right? And so generally speaking, from let's say about week 1 till about 2 months, that's a really great indication to see if the baby is getting enough food, if they're having 2 like nice size bowel movements a day. And so we like to say about, the size of like half a dollar bill, 3/4 of a dollar bill, something like that. It should be substantial, not like little itty bitty bitty ones. If there are little itty bitty bitty ones every single time you change the baby's diaper, 6 to 8 times a day, so that can add up to a dollar bill amount in total. But that's generally what we want to look out for, is having enough bowel movements a day, and then also that there should be enough wet diapers, not just like a little bit wet, but it should feel wet, should be squishy and wet 6 to 8 times over the course of 24 hours. Right. And other than that, it's really focusing on the weight gain of the baby. This is the one time when it's important to weigh ourselves, is when we're dealing with little infants, so we can really know like how much, how their growth is going.
And of course, once you hit puberty, you should just toss that scale altogether, right?
That's right.
But that's a whole other topic.
That's right.
Yeah. So, and I think another thing that mothers don't realize is that when you see a dirty diaper, it's often wet as well. So if you are counting, you need to keep in mind that if the baby's pooped, they've probably also peed, so that should count as both.
Unless you like just changed their diaper and like they were waiting for that like dry diaper in order to start to poop, which a lot of them do.
It's true. They totally stick it to you like that. That's like, they totally do that.
They're all uncomfortable and they're not ready to make because they have this really wet diaper, and then you clean them and then it's time to clean them again.
Right. Or, you give them some diaper free time, and I think that's another nap time nutrition topic too. So as far as when you are ready to stop that breastfeeding relationship, it's when the mother and or the baby is ready to stop that breastfeeding relationship. And if that's at a year, or if that's at 3 years, I mean, I've covered the topic of extended breastfeeding. I'm definitely a fan of not only the nutrition it provides, but the comfort in the relationship. And I don't believe there's ever in history been a 21-year-old who's still breastfeeding. So that's not really a concern for me. So when you do decide that it's time to stop breastfeeding, what are the best ways that you can do that? And what are the worst ways? We talked about cold turkey. So
let's start there. Let's start with the cold turkey, and then let's work to the other way.
Okay.
So there are some women who think that if I'm going to stop nursing or I'm going to start to wean, that means it has to be cold turkey. And that can be very, very detrimental both for the baby and for the mother. For the babies, from their perspective, this is what they were used to. this was a main source of nutrition for them, might have been the only source of nutrition for them. It was a huge source of comfort, right? Babies, they learn about the world through sucking, and they get comforted. All their interactions are through sucking. And if their main source of sucking was through breastfeeding, and suddenly they lost that, so that could be very confusing and shocking to a baby to go cold turkey like that. Obviously, there are some very, very, very rare medical conditions that do require mother-baby relationship when it comes to nursing to end abruptly. But in most cases, more than, making up this statistic, but more than 99% of the time, it's not necessary or even recommended to go abrupt like that. From the mother's perspective, so first and foremost, the physical pain that she'll be in just from getting engorged. The body is used to producing a certain amount of milk over the course of the day. The body gets into sync with what the baby's needs are. It's a supply and demand. So if the baby's been nursing, I don't know, let's say 8 times a day, 10 times a day, so the body gets used to producing that amount of milk over the course of the day. And the body's still going to keep producing it even after the baby stops nursing. So if there's this abrupt stopping, this abrupt weaning, the mother will just get very, very engorged. Engorged means that her breasts will just get very, very full, very hard. That could lead to having a breast infection. Mastitis and other infections are possible. So it's very painful, and it's also that means getting a fever, having to take days off of work, potentially having to take medication. So from a purely physical level, it's very, very painful. Then just from a hormonal level, when a woman stops cold turkey like that, so she stops having the feedback from the baby, that oxytocin, every time there's that letdown, and her hormone levels are going to abruptly drop. During lactation, for most women, their estrogen and their progesterone, our reproductive hormones, are suppressed. And so if a woman stops breastfeeding cold turkey, then all of a sudden there can be like the prolactin drops, and then the progesterone and the estrogen can suddenly jumpstart like that, and that hormonal like imbalance sort of can really throw a woman for a loop.
Mm-hmm. So what do you think is the best way really to stop breastfeeding?
So when the mother or the baby decide, generally speaking, it should be one feeding at a time. One feeding every couple days or every few days, maybe once a week to drop a feeding. It's the type of thing that's really hard to say, do this and everything will be okay. Like for some women, they're able to drop a few feedings at a time without any discomfort or any sort of obvious hormonal changes. And some women really need to go very, very gradually. So it's super important to really connect with yourself and tap into what you're experiencing in your body and notice what's happening. You might reduce a feed, but you might still need to express a little bit of milk when you would have had that feed, to sort of slow down the production that way. Some women are able to go cold turkey with that one feed. Not cold turkey, no feeding at all, but cold turkey with one feed, just dropping that one feed completely. So a woman really has to check in with herself, with her baby, and get that feedback from herself and from her baby, and figure out how to move forward with it.
Thank you. And the real question that started this whole topic is, when you stop breastfeeding, can you stop breastfeeding just overnight and continue to breastfeed during the day?
Absolutely. So I would say also the same thing, that going cold turkey even at night, like let's say the baby is a year old, so they're still sleeping, 12, 14 hours at night at that age. So to stop cold turkey, that means suddenly not breastfeeding from, let's say, 7 p.m. to 7 a.m. That's a long time if you've been feeding, 3 or 4 times at night. It's a long chunk of time to suddenly cut out of things. So again, to try to find the one time that feels good for you and also feels good for your baby, where you can go and comfort your baby in another way. During one feed, let's say that's midnight, right before you are about to go to sleep, or right after you just fell asleep, or whatever it is. You don't want to get up and then, go feed the baby. So that's a really convenient one maybe for you to cut out. So you go and you find another way to come and soothe your baby and deal with any discomforts that might come up inside of your body.
A lot of women, if possible, will also involve the husband at that point, sending him
That's a
in
good point.
because he doesn't have that option of giving milk. He doesn't have that option of giving in per se, and might have more tools at his disposal to calm the baby down without feeding. And so if that's at all possible, that's a good way to do it as well.
And then you get more sleep.
Yeah, and then we'll get more to sleep too. So definitely advocating that, and hopefully my husband is watching this one. So yeah, so you cut down slowly. A lot of times I've been told you can anticipate feeding. So if the baby's used to feeding at 4 a.m., you can set an alarm for 3:45 and wake up. So and move the feeds back slowly. So it's a more gentle way for your body. It's a more gentle way for the baby as well. There are different ways that you can handle that, but the main thing that I really want to get across here is that breastfeeding is not black and white. If you stop at night, you can still go during the day. And if you want to go down to one feed and do that for a long amount of time, that's perfectly fine as well. Each mother-baby pair is going to have a different dynamic, and checking in with yourself, as Rena said, and checking in with the relationship between you and your baby is really going to give you the best guidelines for what you and your baby need. And that's going to be the best way to proceed.
And I really like what you said about some women will find that they can still nurse once a day, and like that's totally fine for them. And that's where really checking in with your body and seeing what your body does is so amazing, because there's some women that if they kind of take out all the extra feeds, they won't have so much milk during that one feed. And there are some women that will have just like plenty of milk for that one feed, and it'll be like a good, amazing nursing session. So
Yeah.
kind of have to see what ends up happening for your own body.
Right.
And each nursing experience will also be different. So if you had a certain experience in the past, it might not be like that next time
Like if you
around.
had twins first and then you have a single.
Something like that, yeah.
That's not me though. So and another thing that I just want to cover that I'm sure I've said before is a very common question is, when is breastfeeding no longer nutritious? And it's a good question, but the answer is that breast milk is always nutritious. And I'm not going to advise you that you should, you grandmother should be nursing your 35-year-old son. But what I am going to say is that it never loses its nutritional value. And that has nothing to do with the age of the child. It has to do with breast milk has a certain nutritional profile, and that changes as the baby gets older. But at some point, it evens out, and you have, this is the nutritional content in breast milk, and that remains no matter how old your child is, or your grandchildren for that matter. I'm just getting across the point that you really have to listen to yourself and your baby and that relationship in order to decide when that relationship needs to come to an end. Because breast milk is always a nutritious option, that's not a factor. You need to check in with yourself and really see where your relationship is.
Well said. I've heard way too many times, oh, your baby's 6 months old now, so now breast milk is just like water to him.
It's not true. It's not true. And it remains a nutritious drink as long as you are willing to provide it. And
that's right.
At the 6 month mark, you're probably going to be starting to introduce solid foods, but you can continue breastfeeding. And at the 12-month mark, the nutrition changes from relying on breast milk or formula to relying on solid food, but that doesn't mean that relationship has to end. It really has to do just with the mother and the child and their relationship. So I think that covers this topic. Come join me next week. I'm going to be talking about PCOS, which is a major topic now, nutritional management, what it means for you with infertility, with symptoms, how to deal with that in a nutritional way. And any questions or comments or topic suggestions, please comment below, and we'll be watching and answering any questions. So if you're local to the Phoenix area, come join me for Toddler Test Kitchen. I do private and personal counseling, and Rena does counseling for intuitive eating, which is the non-diet approach to nutrition and health. And if you want to know more about that, please comment below, and Rena will hit you up.
Awesome.
Great.
All right. Thanks for having me.
See you next week. Thanks, Rena. Thanks so much.
Take care.